Oh, we're not? Good afternoon, everyone. Welcome to the Board of Health meeting of December 20th, 2021. Pursuant to Governor Baker's Are we on? Okay. Sorry about that, everyone. Welcome to the Board of Health meeting of December 20th, 2021. Pursuant to Governor Baker's June 16th, 2021 signing of an act relative to extending certain COVID-19 measures adopted during the state of emergency, including the extension of his March 12th, 2020 order suspending certain provisions of the open meeting law, general law, chapter 30A, section 20, until April 1st, 2022, this meeting of the Chatham Board of Health is being conducted in person and via remote for public participation. Every effort will be made to ensure that public can adequately access the proceedings as provided for in the order. A reminder that persons who would like to listen to this meeting while in progress may do so by calling the phone number 508-945-4410, conference ID number 636-079-781#. While this is a live broadcast and simulcast on Channel 18, despite our best efforts, we may not be able to provide for real-time access. We will post a record of this meeting on the town's website as soon as possible. And now I'm going to turn the meeting over to Vice Chairman Noble Hanson.
Good afternoon. Today's meeting, we have 3 updates. They'll all be by Dr. Duncanson. And the first one is going to be an update discussion of 32 Mill Hill Road.
Okay, thank you, Mr. Vice Chairman. Just quickly updating the Board of Health on the status of the McGrath property up on Mill Hill Road. I did send out some pictures towards the end of last week to the board. Judy was up there early last week. I was up in the latter part of the week. There has been some improvement in the road right-of-way area with material being removed. There was also a couple of trailers full of material that looked like they were going to be moved imminently. I didn't get a chance to get up there today to see if there's been any further cleanup of the road layout, but it did appear that some things were progressing to a certain extent. The DPW has received so far 2 bids for removal of the material within the road layout. One from Robert Childs, one from Dubus. They range from about $15,000 up to $30,000. Under the procurement law, we're supposed to have 3 bids. We're still waiting for that 3rd bid. If we don't get it, we don't absolutely need it. We just have to make an effort to get 3 bids. And then once that 3rd bid either comes in or a decision is made that, the other firm is not going to bid on it, we'll go ahead and determine which one of these is most appropriate. I know there's been a lot of talk about available funding, and that obviously is an issue. I did talk to the finance director earlier this afternoon with regard to the amount of these bids, because frankly, they're lower than I think DPW had originally estimated. And we agreed that if the bids are going to be in this range, we can go after a reserve fund transfer. So we would make an application to the Finance Committee. They have a pool of money for unforeseen things that come up during the year. And we could make an application to them to get that money transferred over to where one of these firms could be hired to do the cleanup within the road layout. So that is the update as it is as of this afternoon. Happy to try to answer any questions.
Questions from the board?
Yeah. What happened? Where did everything go?
That I do not know. We do know from past work with Mr. McGrath that the metals and all he was taking off Cape to be recycled. So I'm assuming, considering we haven't gotten any other complaints of material being dumped in Chatham, that may be the case here, that it was being taken off Cape for recycling. Because it is, it's 95% metal waste that could be recycled.
Yeah. But I tried to look into the yard to see whether or not a lot of it just got pushed in there somewhere. I couldn't tell by,
Yeah, when I
Right.
was out there in the pictures I took, it didn't look like material was being just, pushed further in or dumped over the banking. It looked like it had actually been removed off-site, because the piles that were behind the stakes delineating the layout didn't really look any different than they had before.
I got just one more question. Now, that bid that you put out, that was when all the stuff was on the road? Was all the junk on the road when they went up there to put in the bid for us?
Yes, I believe so. So that may
Okay,
further impact these bids, yes.
okay, thank you.
Harold?
How long are you going to wait for that third bid to make a decision?
Probably Wednesday of this week, I think, and because I don't know, I have to talk with DPW to see if they gave the bidders a certain time period to get back to them, or if it was just kind of get us a bid as quickly as you can kind of thing, because this wasn't done with a formal bid, nothing in writing or anything. I believe it was all done over the phone. So I would think, Wednesday of this week would probably be a good day, and then we'll make a decision.
Dick?
Yeah, I drove over there the end of last week. It was either Thursday or Friday, and when I drove by, Mr. McGrath was in the road picking up trash and throwing it into his property. So some of it's getting moved, but he was taking it off the roadway.
Yeah.
Yeah, I had a couple questions. It appeared to me that some of it at least was being stacked up right on his property on the other side of the line. You can see a big wall, which raises the question of how are you going to handle the rest of it, that second part. The other question I had is, has the status of the trailers been determined? There's one that's probably not registered, and then there's some that are registered. And in a way, he's got sort of a mobile junkyard, and he moves them around. So I thought that we heard once the police were there and they were checking on some things.
Yeah, I will follow up with the PD because they were, Lieutenant Goddard was following up on the registration status of the various trailers. So I will touch base with him.
Because I know the neighbors had complained that the trailers are sometimes a problem, too.
Yeah.
And then the other broad question is, the second part, cleaning up the property.
Yep.
What's the deadline for a warrant article for the May meeting?
Generally mid-January.
Mid-January.
Mid-January, yeah.
Okay.
Yep.
Are we going to be able to put together a warrant
Yeah.
article by mid-January?
Yeah.
You can make an estimate of cost, and
Yep.
you don't need a formal survey of the whole property, or
No, we
just
don't
an
need
estimate?
to get the article in as a placeholder, no. I mean,
Okay.
as you know, town meeting articles can be amended down on town meeting floor. So we would estimate on the high side, and then it could always be amended down. You just can't amend higher.
Okay, so that can be dealt with at our next meeting?
Yeah.
So-
Yeah.
Okay. All right, that's fine. Any more questions about the McGrath property?
Has everybody seen it since? No. It's,
You need to turn your microphone on. Push the button.
it looks like he's doing some work, but not a hell of a lot. He's moving 3 or 4 things here, goes back, he put them somewhere else. So, we have to live with it.
Yeah, I think if he's cleaning up, the question would come up, should we alter what we're doing? But my own thought was, I think the work he's doing is probably a consequence of what we've done on the board here, so we should keep pushing the way we have been, so.
Right.
yeah, that's, I
Right,
think,
you're
what
right.
you're saying.
Yeah.
Yeah.
Okay, oh, we have
Well-
one,
We have one person from the audience. Victoria Chase, did you want to say something?
Yes, that would be great. Can you hear me okay?
Yep.
I just wanted to thank you all for the work that you've put in on this, and the neighbors and I really do appreciate it. And I think that you guys have a really clear and concise idea of what needs to be done. And I just, again, want to thank you for following through with this and going forward. So hats off to you guys.
Okay, thank you very much. Dick, did you have another?
Yeah, I just wanted to say that either at the next meeting or the meeting following that, we need to make a decision about a deadline. That you're given 2 weeks or 3 weeks or whatever. And after that time, if there's any debris in the roadway, it's going to be cleaned up at his expense.
Okay.
Yeah, we did discuss sending him a letter before we actually go forward with it. So we do have a letter that the town council has written, so we will send that before we get to that point.
It's going to have a deadline in that letter.
Right, we will,
Okay.
and we
Yeah.
can discuss that, yep.
Right.
Okay, so we can move on to the next update on Chatham water quality. Dr. Duncanson?
Okay, again, just relatively quickly, I just wanted to give you an update on a couple things that are going on. With regard to wells 10 and 11, we had a progress meeting with the engineers last week on wells 10 and 11, which are which are the new wells that are going to be up by Mill Pond in the northwest corner of Chatham. We've talked about before that the screens and casings were installed almost 15 years ago now, but the well pumps and the well buildings and the piping and all was never put in place. That is moving along. At the progress meeting last week, we saw the 60% design plans for that new facility. So they are moving along relatively quickly here to get the design drawings done. Borings at the site were completed on December 8th. The survey work was completed the first week in November. And so the 60% design plans are pretty well done, which show the access road, the building, the new well houses and whatnot. We did, just discuss a number of things that the engineers kind of needed to finish up. And that had to do with, some piping, the way it was going to be routed, solar panels on the building roof and things like that. So the thought is to get this project to a point by the end of this month that it could go out to bid in early 2022. Bids would be due sometime probably in the March-April timeframe with a contractor coming on board, maybe over the summer, but definitely in the fall to get that work underway, recognizing it's probably about a 9-month construction period. So with the intent then of getting these wells online, in early 2023. So that project for wells 10 and 11 is on track and moving along, relatively quickly, considering they're already at the 60% design stage. All right. Then the other topic is wells 5 and 8, which, as you know, are the wells up at Training Field, where we've had detectable PCE. Remember, there's been no PC in any of the South Chatham wells or the Town Forest wells. It's been limited to wells 5 and 8 so far. The latest test results, which were samples taken on November 16th, we are still detecting elevated levels of PFAS. Sorry, PCE was the old one in well number 4. But we're still detecting elevated levels of PFAS in wells 5, both in the raw water as well as the treated water, which you'd expect. And we are also detecting it in well 8. So that's the latest set of test results. More tests were taken in early December, but the lab is currently working on about a 3-week turnaround because, as you can imagine, pretty much everybody in Massachusetts is looking for PFAS testing now. where, a year ago, hardly anybody was. But now that the new DP rules kicked in the springtime, a lot of communities are testing. So unfortunately, what used to be a 3 to 5 day turnaround has now turned into like a 3-week turnaround for lab results. So we're anticipating more results coming in shortly. And then in terms of wells 5 and 8, we had a kickoff meeting with the engineers last week to review, just to kind of go over pretty much the general ground rules of design for wells 5 and 8. They are planning to build a water treatment plant similar to one that we built in in the town forest for wells 6, 7, and 9. This plant will handle wells 5 and 8. It will incorporate iron and manganese removal as well as PFAS removal. If you remember some of the early discussions, iron and manganese, we were starting to go down the road of iron and manganese design for removal anyway. That has just been accelerated now with the detection of PFAS, because you've got to take the iron and manganese out before you can effectively take out the PFAS. So that design is basically started. We're lucky because we have the Morton Road treatment plant to kind of use as a design guide, if you will. We're just going to pretty much mimic that at a different location for here. In addition, for the temporary storage, the granule activated carbon vessel has been ordered. Instead of having 2 of them, there's the ability to get one slightly larger vessel. So that order has been placed. The delivery is expected around the beginning of April. And then a couple of weeks to make all the various connections. So hopefully, not hopefully, but the expectation is we will have that temporary GAC removal of PFAS online before the start of the busy summer season. For water use. Once the vessel is here and set up and operational, they will do a pilot study to kind of tweak and whatnot, contact times and everything else. But still, even with that, the expectation is the temporary unit will be online by the beginning of the summer. Then that temporary vessel, shouldn't call it temporary, but the temporary arrangement will basically then be incorporated into the permanent building. So we're going to make use of pretty much everything that is required to get it up temporarily, but go ahead and incorporate that vessel as well as other components into the design of the permanent treatment facility. So we'll have PFAS removal temporarily to get us through next summer, summer 2022. Again, with the expectation that the full treatment process will be online for summer 2023. So that's a quick update on where those things stand. In terms of the PFAS source assessment study, we're still working out the logistics of that and the scope of services for that. It did take a little bit of a backseat to getting 5 and 8 online and 10 and 11 online. But we're now going to move back into that and get that RFP out. I think I've told you before, we received 2 proposals. They really are apples and oranges, so we're trying to get it to one unified scope that we can have both firms kind of take a look at and give us prices on, because right now the scopes are drastically different. As a result, the prices are drastically different. So that's a quick update on the water supply side of things. Happy to answer any questions.
The activated charcoal filter, does that activated charcoal have to be replaced, or can it be backflushed like a swimming pool filter?
No, in general with PFAS, it has to be replaced.
How often do you have to do that?
That we don't know. That will be determined during the pilot study. But yeah, that's one of the questions, because I asked that various question when we had our progress meeting last week, is do we have an idea of how quickly it will be tied up, and then how quickly we'll have to replace it. One of the topics that I think is still up for discussion is right now, the plan is to only treat well number 5, and then to blend that with well, and so basically treat well number 5 down to below the limits of detection, and then blend that with well number 8, which would get the PFAS level as it enters the distribution system down significantly. It wouldn't get it down to below detection limits, but it would get it down significantly. I did raise a question last week as to whether or not it makes sense to treat both wells 5 and 8 and get them both down to below detection limits before putting it into the distribution system. So the engineers were going to go back and rerun those calculations as to whether or not the new larger vessel that we were able to procure has enough capacity and all to do that. The downside being is how long would it take to have to replace the GAC in between? If we're treating both wells at this level, how long would the expectation be before we'd have to replace that media? So they're back running all those calculations right now so that we can have some data to review before the town makes a decision as to whether or not treating one well and blending it with the other versus treating both wells.
You said that in the last test, 2 of the wells had elevated PFAS. Were they elevated above 20?
No, they were in the, 17 to 19, or actually 15 to a high, 15.1 to a high of 18.1. So they are below 20. We did have one set in well number 5 at the beginning of November that were above 20, but that has dropped down a little bit now. But one thing, you always have to be aware, we're not pumping wells 5 and 8. We're not using them right now. So that's always a concern that we're not drawing that water into the well. So the good news is, as you probably know from reading in the Chronicle, well number 4 is now online, which is the one that was shut down in the early 90s due to the PCE contamination. That well is back online now. It's only being pumped a couple hours a day, but so far the test results from there for PFAS have been non-detect. But it's not being pumped very much. It's only being pumped 2 or 3 hours a day because, as you know, this time of the year, irrigation systems and everything else are turned off. People are leaving. Water use has dropped off. Plus, we saw a substantial reduction in water use just from the conservation measures and the water ban. So, it's good news. I'm not totally ready to say it's great news, but it is good news that well 4 is online. So we have that capacity, which then allows the town to do some work on some of the other wells in South Chatham. Routine maintenance kind of thing that we would do in the wintertime anyway. So, but we have that additional capacity if we need it.
Other questions from the board? Judy, somebody from out?
We have one question from the audience. Elaine Gibbs.
Thank you very much. At the December 7th meeting, Tom Temple was talking about wells 5 and 8 and talking about, bringing them up to speed, but he had mentioned the possibility of not until fall. So I was wondering what the impact would be if, for whatever reason, delays in construction, 5 and 8 cannot be brought online by June when we have peak season. Is well 4 going to be able to take over that? I'm not sure how many gallons they produce a day. And what would the situation be if we can't get 5 and 8 up in time for the summer?
Well 4 will not replace 5 and 8 in total. Well 4 is a fairly large production well, but it can't replace 5 and 8 completely. So, taking that into account, there would have to be, water conservation measures, potentially a water ban. As you know, the water ban is still in effect. It has not been rescinded. And I think we would just have to look, in the crystal ball 5-6 months from now, if there are delays in getting the temporary system online at 5 and 8, whether the current water ban would be sufficient or require something additional. And, that's anybody's guess at this point. As I've said before, it all depends too on precipitation over the winter. We are not really seeing any rebound of any significance in the groundwater levels. I looked at that last week, and, you know, we did get a bump after we had a couple of those heavy rainstorms this fall, but it hasn't turned into a sustained rebound. So, you know, given the fact that we were already starting out with groundwater levels very low this year after a couple of years of you know, semi-drought conditions, a lot of it's going to depend on this winter. You know, we're already into mid-December and we haven't had any snowfall yet. We haven't really had any significant rainfall events. So, you know, it's all just conjecture at this point as to where we may be, say, come June 1 of next year. So.
My only other question is, I understand that obviously if we're in a drought, that's a totally different thing. But if there is sufficient water in the aquifer, do we have the capacity to be able to pump it to supply it, or is well 4 not sufficient? I guess that was my question.
Well, as I said, well 4 is not sufficient to replace 5 and 8. And it would, you know, we'd have to take a look at that versus demand. But if we're doing things, as I said, to cut down on demand through a water ban or other measures, you know, we'd have to see where we are versus what the usage is as to whether or not we have enough capacity. I mean, you know, you can always pump wells longer. We generally don't like to pump them more than 16 hours a day, roughly. You can always pump wells longer, 18, 20, 22, 24 hours a day. It's not good for the equipment over the long term, but if it's a, you know, something you need to do over a short period of time just to get through a, you know, a holiday weekend or something like that, you can do it. So I don't think there's any chance that Chatham is going to run out of water. And we also have, as you probably are aware, we have an interconnection with Harwich. You know, we purposely put those in for, you know, catastrophic need if the need ever arises, but you always hope it doesn't. So, but it's too early to tell what next summer may be like, because, you know, we could get heavy snowfall in February and March. We could get a hurricane early in the season. Who knows? And you know, the aquifer could recover very well and, you know, reduce the strain on our system. So.
Thank you.
Okay, if there's no further questions, we'll go to the third update discussion, COVID-19. Dr. Duncanson as well.
Okay, so quickly running through the COVID numbers. Let me share my screen here with you, because I'm a graphic kind of guy and I always like to see pictures. So the first graph that I have up on the screen, this is our monthly case count to date, and I did it as of yesterday afternoon because we're not quite with the end of today. As of yesterday afternoon, or yesterday, we had a total of 484 cases since the beginning of the pandemic. So beginning for us roughly in March of 2020. It's hard to believe we're rapidly approaching 2 years of this. In November, we had a total of 44 cases, which is approximately 3 times as many cases as we had in November of 2020. This year we had 44. In November of 2020, we only had 13 cases total. So far in December for this year, we have had 33 cases, and we had 57 cases in total December last year. And so given the fact that we are at the 19th of the month, we have 12 more days to go in December, and we're a little bit more than halfway to what we had last year. I dare say we are going to probably meet, maybe slightly exceed our case count compared to last December. So, you know, it's not dire news, but it's not good news either. Our percent positivity and the average daily incident rate are also, percent positivity peaked and now it's trending down a little bit. Hopefully that will continue because that's a positive sign. If you remember anything above that dotted line at 5% is considered, you know, community spread under pandemic conditions. So we're above that, and, you know, all you have to do is watch the news, read the newspaper and all to know the Cape is in that circumstance, Massachusetts is in that circumstance, and nationally, you know, cases are just skyrocketing. And then in terms of our 14-day average daily incident rate, that likewise is continuing to go up. It has surpassed the peak that we saw last spring. It has surpassed the peak that we saw back in the August-September timeframe. And we're approaching levels that we hadn't seen since last December, January, February kind of timeframe right after the holiday period. The cases are what they are. The guidance from the various health agencies at the state and federal and doctors and everybody else is, yes, we're seeing a fourth surge. Get vaccinated. If you're vaccinated, get your booster shot and wear a mask in all indoor settings. Barnstable County is in the high-risk group, according to CDC, high transmission for community transmission. And so all the indicators are that, it's out there. I did forward around to the board and others earlier this afternoon an update that came out from the Department of Public Health that took a look at the hospitalizations and all in Massachusetts. The vast majority of those, I think it was more than 97%, are in unvaccinated individuals. And vaccinated individuals, when they are the source of breakthrough cases, if you will, the symptoms are very mild or none at all. So it just, it highlights once again the importance of vaccinations and booster shots. There is some preliminary data coming out that the current vaccines, the Pfizer and Moderna vaccines, are effective against the Omicron variant. So, that's been a topic, and we're starting now to see the first data coming out of the studies looking at that specifically, considering the Omicron variant really didn't start to show up until early to mid-November. We're just beginning that one. But like many other countries around the globe, it's more than likely that the Omicron variant will surpass the Delta variant as the predominant strain in the U.S. In the not too distant future. So it just reinforces wear a mask in indoor public settings, or even, and get tested when you can. I know right now, we sent out some information last week that the state is providing 2.1 million home test kits. There's 4 communities on the Cape that are getting those: Barnstable, Dennis, Orleans, and Eastham. Chatham was not one of the communities that were picked. I'm not quite sure. Well, I shouldn't say it. I reviewed how the state made their decisions to pick which communities, because they're targeting 102 communities out of the 351 that are in Massachusetts. I still, after reviewing that, I still don't fully understand how they picked the 4 communities on the Cape. One I can understand, but the other 3 don't make sense considering some of the other communities around them. But that's neither here nor there. So the state is distributing those and asking the communities to target, the high-risk individuals, low-income individuals that, may not be able to run out to CVS or Walgreens or Walmart and spend $20 or $30 on a home test kit. But because of the holiday period, we are hearing anecdotally that is almost next to impossible now to find those home test kits locally, just because there's been such a run on them in advance of the holiday season. So we're still waiting to hear from the state. They were supposed to be setting up a program whereby communities could purchase home test kits for their community residents at a significant discount rate. We haven't gotten any details on that yet. I was hoping we were going to have that information by the end of last week, but it has still not been forthcoming from the state. The test kits the state purchased, they ended up paying $5 a piece for those. When you think the average price for the same thing in a pharmacy is $20 to $25, it was a significant discount. So we're hoping that we can participate in a similar program if the state can negotiate with the suppliers of those test kits. So happy to answer any questions.
Which towns were on the Cape were supplied?
Barnstable, Dennis, Eastham, and Orleans were the 4 communities that the state picked on the Cape.
That was supposed to be based on the income level in those towns?
It was supposed to be based on income level, the incident rate, and a number of factors. That's why I say, I had to read it 2 or 3 times, and it's still didn't, but, the state obviously had access to a lot of data that we don't have, so.
I have 2 questions. First of all, what do we know about Omicron in Barnstable County?
Not a whole lot. I haven't seen a lot of.
The Omicron is supposed to spread and replicate remarkably fast, and it's supposed to be about as infectious as measles. And so that's why it's just taking off. And if it hasn't gotten here yet, it will. And when it does, those curves are the trajectory is gonna.
Yeah, I think it's probably safe to say it's here.
Yeah.
I'd be very surprised if it wasn't. Just knowing what we do know. But, not every positive test is sent out for genomic testing. Not every person that's positive ends up going for a test because they know what it is and they just stay home and do what they're supposed to do. So I think we'd all be naive if we were to think that Omicron is not yet on the Cape.
All right, and then there's a lot of concern that people are saying, well, Omicron's no big deal, it's like a cold, who cares? We don't have to worry about it, we don't have to wear masks, we don't have to do anything.
Right.
Because it's nothing, but it does spread remarkably, and it gets to unvaccinated people. The other question is, these test kits that are being sent out, I haven't seen anything about what instructions people are getting. And I've seen people interviewed on TV and they say, oh, that's great, I get the test kit. As soon as I get it, I'll take it and I'll know if I have COVID. And so that's just wasting a test kit. That people need to know that you take it if you've been exposed or if you're having symptoms. And then if it's negative and you were exposed, you really have to take it every day for 4 or 5 days to find out, and where are they going to get these additional test kits?
Yeah, I don't know.
The whole thing is kind of ridiculous, just dumping all of these test kits randomly on all these people without a whole lot of education
Yeah,
about
I
how to
don't
use
know
them.
what kind of information the state is handing out with these kits in terms of guidance for their use. They, obviously, we're not getting any, so we haven't seen anything. But, I don't disagree with you. There needs to be some guidance for individuals with, it's the same thing, people running out to CVS or Walgreens or Walmart or wherever and buying a test kit. They need to utilize it under the appropriate conditions.
I logged into a CVS the day before yesterday to order a test kit by mail, just to have a couple of kits in case I needed to use one.
Yeah.
And delivery date is like, December 28th to January 10th. And that's for mail order from CVS.
Yeah.
So that if you're exposed, you're not going to get one at CVS. You're going to have to go stand in line at a walk-in clinic or something to get tested.
All the Cape testing clinics between now and basically New Year's are full. And I mean, in some respects it's good. People are heeding the advice. They're getting tested before they go out and have Christmas or New Year's or whatever. But there's only so much capacity, and right now the capacity looks like it's pretty much at its limit. So people just need to continue to do the right things. Wear a mask, and, if you've got friends or relatives that are not vaccinated and you think there's any chance, best thing to do is stay away. I hate to say it with the holidays here, but, other people are taking the right thing. They're saying, no, we're not going to visit relatives. We're not going out. We're doing what we did last year. We're just hunkering down at home and having a quiet holiday at home. And there's nothing wrong with that.
Well, there's a lot of crazy information out there. On the NBC News, they'll say, well, if you want to be safe at Christmas time in Massachusetts, when you have your family and open up all your windows and doors for your Christmas dinner. when it's 28 degrees out.
Yeah.
Do you have any number of people that are vaccinated on the Cape? Is there any records to that? or anything?
On the Cape, I don't have it with me, but we can certainly get that and share with
I was wondering, is it a good number or is it bad?
It's a fairly high number of people that are vaccinated on the Cape, yeah.
Because you remember, I mean, I had the
Yep.
question before about everyone in Chatham being, that has to be
Yeah,
vaccinated.
I mean, Chatham, we're good. Last time I looked at those numbers, we were between 80 and 85% vaccinated of the entire, age group that were eligible at the time. I haven't checked, in the last day or so to see what the numbers are for, the youngest age group, which are the ones that, were the last to be eligible, if you will. But we could certainly do that. We can have that for the next meeting.
Because my daughter's a school teacher, and, I said, has the school system required that you do it? And she said, no. And it's surprising. I mean, they're working with little kids that aren't even vaccinated.
Yeah.
She
Yeah,
doubles mask when she goes in.
Yeah, it's the old problem that we've been having since the beginning of this thing. You have to get vaccinated for measles and smallpox and all this other stuff to go to school, but we haven't required COVID, vaccine to go to school, which, that's not a public health issue, that's a politics issue, unfortunately. And until that changes, we're going to see that kind of thing.
As of Friday, the county is saying that Barnstable County had a 77% of all residents are fully vaccinated. That's the whole county.
I think that number includes children then.
That includes, that's all residents.
All residents, yeah.
Yep.
Yeah.
I see today that they're changing the recommendations or considering changing the recommendations for the booster for Moderna. Moderna came out with this idea of giving a half-dose booster so that they'd have a lot of vaccine to send to needy countries around the world.
Yep.
And now they're finding out that the half-dose doesn't provide as good a level of immunity and particularly may not be sufficient for Omicron or Delta in breakthroughs. And so now they're talking about going back and increasing the dose from 50 to 100 to give the same dose for the booster that they gave for the original 2 shots. Pfizer always gave the same dose.
Right.
But Moderna had this idea, which I don't know that it was based on economics or what, but they.
Well, it was based on
because-
data they had at the time.
I don't
And they
think
were
they
dealing just
decreased
with
the
the Delta
price
variant.
of the dose when they decreased the dose by 50%.
Yeah.
But
If you want to get a COVID test
Yep.
and go to a testing site, does Cape Cod Healthcare still have its testing site at the back of the campus there, and you call your primary care?
Yes. Yep. And I, as you probably know, I was in Europe recently. As soon as I got home, I went online at CVS and got an appointment for 5 days later for a PCR test. So you can get, those kind of tests.
Cape Cod Healthcare, CVS.
Yep, CVS, Walgreens.
And they are readily available.
Yeah,
Yeah.
yeah. They're a little tighter right now because everybody was scrambling to get it before the holiday, heeding the advice,
Yeah,
that they were hearing.
you usually have to, it's 3 to 5 days out, I think, to schedule one at a local pharmacy.
Yep.
But Outer Cape Health, Cape Cod Healthcare, if you can get through to them, call them to make appointments.
Yeah.
Seems
so
like the
people
best
should be
way.
quarantining until they get the test.
If
If they're trying to get a test because they're symptomatic or they think they've been exposed,
Oh, they
they
should be.
should be
Yes.
quarantining.
They should be
Until they
quarantining
get
until
the
they get
test.
the
they're
negative test.
symptomatic, yes.
Right.
Yeah.
If they're symptomatic or they've been identified as a
they?
close contact, they should be quarantining until they get the test. Or if you've traveled significantly, you don't need to quarantine, but you should be wearing a mask until you get that negative test back.
Right, and now if you're coming back to the United States,
Mm-hmm.
you need to get an antigen test within 24 hours of entering the United States. But then you should get an additional test.
Right,
3 or 4 days later.
yes.
And I don't know how they're enforcing that.
Having just gone through that experience, I can tell you, You have to get a PCR antigen test within 1 day of your flight back to the US. You can't get on the airline because they did check our paperwork that we had gotten our test and it was negative to get on the plane. But then once you get back in the US, the recommendation is you get tested again 4 to 5 days later, which we did, but there's nobody looking over your shoulder for that one.
It's just a recommendation.
Yeah,
Yeah.
yeah,
So-
yeah.
Yeah, because if you're coming from an endemic area, the fact that you were negative before you got on the plane doesn't mean, you may turn positive 3 days later.
Yeah. Well, I can tell you, just from personal experience, having spent 2 weeks in Europe, the Europeans have a better handle on this than we do. I mean, you see people out pretty much anywhere outside, they're still wearing their masks. We had to show our CDC cards to get into any restaurant. We had to show our CDC cards to get into any museum. They all have.
It's like New York City.
Europe, they have an app, and they have a barcode. So when you go into a restaurant or whatever, they scan your barcode. But they will accept the US CDC card for proof of vaccination. But yeah, people over there, they're not making the big deal about wearing masks and all that. Unfortunately, we see in the US in some places,
Okay, are there people calling in to have questions?
Elaine, did you have a question?
Yes, just quickly, just to be clear, since there are very few test kits available, there are no test kits available. If someone is symptomatic, you're saying that if we call Cape Cod Healthcare, or like Fontaine, that they should be able to make an appointment within the potentially contagious period so that we can get PCR tests, because I was thinking that that is a problem. That people could be sick, they don't know what they have, and it would be hard to get a PCR. But you're saying within the contagious period, they should be able to get an appointment.
If people are
Somewhere.
sick, they should call their primary care physician, who should be able to refer them to Cape Cod Hospital or out of Cape Health for a PCR test. So that's
Okay.
correct.
Yeah, I mean, if you're sick, that's what I'm saying, that
Yeah,
you have flu-like symptoms, but we don't know. So obviously, people will call their doctors, but I'm saying, is that the case, that Cape Cod Healthcare does have sufficient
Yes.
capacity to be able to test people within the contagious period?
I believe they do, yes.
Okay, thank you.
Okay, do we have Yeah, and then, okay, our last item is, we have minutes from December 6th for people to review, and any changes, if not, a motion to accept.
I'd like to make a motion to approve the minutes of December 6th.
Okay, and then a second.
Second, adjourn.
Okay, all in favor say aye.
Aye.
Anyone opposed? Okay, so we accept the minutes. And I think that's all we have on the business schedule. Okay, so we can close the meeting.
Motion to adjourn.
Motion to adjourn?
Make a motion to adjourn, please.
Okay, a second.
Second.
Everyone in favor say aye.
Aye.
Nobody would know.
Anyone opposed? Okay, the meeting's adjourned.
Well, don't you, when it's absent, don't you step up? If there's not one, only if there's not one, if there's not one.